afternoon, everyone. I'm Mimi Curtis, and I'm going to be presenting on breast cancer and the costs that are associated with it. So a little bit of background. First off, what is cancer? Cancer are cells that are growing at a rapid rate and crowd the normal cells, making it hard for a person's body to function properly. Cancer can be present in any part of the body, and it can also metastasize, which is the process of cancer spreading around the body. However, when cancer metastasizes, it's still considered the cancer that it originated at. So if you have breast cancer and it metastasized to your lungs, your liver, it is still considered breast cancer, but it just has spread throughout the body. So next I'm going to show a little video just to kind of give direct, indirect costs and a little bit about the treatment.
There are multiple costs when it comes to breast cancer. A number one cost is an emotional cost. It's the trauma of the diagnosis, the trauma to you and members of your family. That has a cost. There's the cost of breast cancer when it comes to lost days at work or having to hire other people that help with care at home. Then there are the obvious costs of breast cancer, depending on what kind of insurance coverage that you have and what the co-pays are like and what the stage of the breast cancer is in the first place. The cynic would say, well, gee, mastectomy without reconstruction is a low-cost option. Yeah, it sure is, but it has a high cost when it comes to the emotional side. So typically the costs for breast cancer involve the surgery. They involve then the other adjunctive treatments. Those other adjunctive therapies or treatments involve often anti-hormonal therapy, perhaps chemotherapy, perhaps radiation therapy. There are some set of circumstances that I've seen where patients have had to use assistance from their own state governments to cover the co-pays because their co-pays are so high, for the policy that they have compared to what they're living they're making, et cetera, et cetera. Fortunately, there are financial advisors around. In most hospital settings, there are social workers that can help work our way through this. One of the other questions that comes up is, well, wait a minute, maybe we can lower overall health care costs, and particularly the cost of breast cancer treatment, if we use complementary or alternative forms of treatment. Those of us who are in the field full time, most of us, including myself, don't have objections to things that are complementary.
Okay, so that's just a little bit about, So next are the different treatment types going along with breast cancer and really any cancer. So there are 5 main ones: chemotherapy, radiation, surgery, hormonal therapy, targeted therapy. The top 3 are the most common and are used usually in a combination to help reduce the cancer and hopefully end up curing it in the long run. So next I'm going to talk about the direct cost of cancer. So as we know, breast cancer is the most common type of cancer. Usually it's mostly in women, but men can be diagnosed with it as well. And cancer is usually diagnosed in the elderly more commonly than younger people. So breast cancer alone cost $15 to $20 billion in 2001. And the sad thing is that not everyone who sought treatment, which that $15 to $20 billion was spent on, were actually cured. Based on the projection of the cost of cancer care in the United States, by 2030, patients 65 years and older are going to have an increased payment of $30,000 to pay for their treatment and their appointments and tests and everything like that. And the reason why these costs are increasing are because they're trying to make the treatments, such as the chemotherapy, more concentrated to hopefully do less sessions and hopefully get rid of it sooner than they would be before. Another direct cost would be that the insurance cost does rise when a person is diagnosed because they have to pay for their screenings, their tests, the screening tests, the treatments, the different appointments they have to attend, and there's some things that go along with different insurances than others. So next I will be discussing the indirect costs, and not all of these have to do like with the actual like physical costs, but like more the emotional, like he had mentioned in the video. So a big one that no one really can ignore is the death rates that go along with insurance. So, and like in comparison with insurance, so for patients who are uninsured, there's a 49% higher death rate than people who are insured by private insurance. And patients under Medicare have a 40% higher death rate than private insured patients as well. Another big indirect cost would be someone's overall lifestyle adjustments that they have to make. I went through this with some people in my family, so I know how big like the overall lifestyle adjustments are. Biggest one is probably for them is diet changes. A lot of people eat really poorly, and they have to find, because they don't have enough money to like pay for like the nicer, healthier organic foods. So they have to find ways to like change their diet as best they can. A lot of times they will go to a nutrition center, which sometimes the cancer centers will provide free nutrition lessons to the patients, but not always, because some cancer places are not as in-depth as others. Another lifestyle adjustment would be the physical activity. It is hard for some people to get up, move around, especially after treatment. They're still trying to recover, their body's trying to adapt, but people need to be as in shape as they can before going into everything, and coming out, they need to be able to try and get up and start walking as much as they can, slowly build back their endurance and everything. So a lot of times people will purchase like a really small gym membership just to go walk on a track, walk on a treadmill, just to kind of get themselves going again. A big indirect cost would be neuropathy. It is a neuropathy, for those who don't know, is a disease or dysfunction of one or more peripheral nerves, typically causing numbness or weakness. It's most common in fingers and toes. So it's kind of one of those things that you can't really ignore, because if it's in your fingers, you can't hold on to an object. It's easy to slip out. Walking is hard. Your feet just can't even put any pressure on. It hurts to put on socks and shoes. It's just, it affects like everyday activities and everyday life. You can't even barely put a blanket over your feet. Another indirect cost, I believe Erin had mentioned this in her presentation as well, when someone has affected the surgical procedures, their nipples are removed, so they end up getting a three-dimensional tattoo to kind of boost their self-confidence, so they feel better about themselves. This can be a direct or indirect cost, because some insurances do cover for, they'll either cover half of it or all of it or none at all. So it kind of just depends on what program you have for insurance, but I think it's more of an indirect, so. And then kind of like what affects the costs overall is obviously the size and location of a tumor. You don't really, that depends on how concentrated it's gonna be. If the cancer decides to spread, you're not really sure where it's gonna be, so it's harder to do, say, the targeted therapy, because it's all over. What type of treatment you get, how long you have to get the treatment, that's gonna be a huge effect on it as well. The severity of your cancer, what stage it's at, and another big thing is if you relapse. Then you have to go through the whole process again, which is really hard on some people, because it's almost like going through it all over again, so it's gonna cost twice as much and has a big effect on family members and the patient.